Good afternoon, everyone. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UVA and UVB rays, which makes skin more prone to wrinkles, melasma, and acne. Acne is caused by a combination of hormones, oil, bacteria, etc. When oil, dead skin cells, and bacteria clog the follicles, sebum can't escape the pores. This leads to acne. According to a survey, 67% of people in India are not using sunscreen as their daily skincare routine. Several things about sunscreen that we people are not aware and that makes us not to include sunscreen as an integral part of skincare routine. So to keep you informed, today we are here to know more about sunscreen and acne. So let's connect today with our skin expert, Dr. Priyanka Jaju, live from Ghaziabad. Dr. Priyanka is an upcoming dynamic dermatologist based out of Ghaziabad. Dr. Priyanka is consultant dermatologist and cosmetologist in Leelavati Skin and Laser Center, Delhi and Ghaziabad. She has done MD from SNMC and Research Center, which is a medical college based in Bagalkot. Today, she will talk about the great topic, sunscreen and acne. A very warm welcome to you, Dr. Priyanka Jaju. It's a pleasure to have you with us.
It's a pleasure to be on this platform, and I must say you guys are doing a wonderful work in bringing awareness and educating the general public about every small thing possible, starting from sunscreen, starting from acne, everything. And what you guys are doing is amazing.
Thank you so very much for all the humble and kind things that you just said. And the whole purpose is to bring awareness about various things and to keep ourselves beautiful, spotless. So to start with us today, we are going to talk about sunscreen and acne. I'd like to start with the usage of sunscreen because a very normal concept that we have in our head, a very common notion that we have in our head is that sunscreen is important only when it's sunny outside and I'm going out or I'm exposed to the sun. Otherwise, do we really need to wear sunscreen every day? Please shed some light over it.
Yeah, so that is what we've always been hearing and always been, have this thing in our mind that sunscreen is only to protect us from the sun. But the newer concepts which is coming up, there's something called visible light or blue light. So sun rays, it's basically, as we all know, it contains UVA, UVB, and UVC. UVC is something which doesn't reach our earth. UVB is something which helps in our vitamin B production, but it causes early sunburn. And UVA is the one which is most dangerous. So this is something we all know, and this is something we all try to protect ourselves from by wearing sunscreen when going out in the sun. But there's something else called blue light or infrared light, which is usually from the LED screens, that is your mobile screens, that is your computers, desktops. Now there's work from home, post-COVID, everyone is on their mobile or their desktop. So definitely there's a lot of increase in cases of pigmentation, increase in cases of post-inflammatory pigmentation, melasma cases. Post-COVID, because you're always at home, not wearing sunscreen because of this myth or notion that you don't have to wear sunscreen. So, and then they found out that the main cause is because of the blue light. So definitely when you're at home, we need to wear sunscreen. Another thing is when you're sitting near the glass windows, you're going out to, dry your clothes in the sun, it's for 5 minutes. But that is going to cause a lot of harm to your skin. And so definitely recommended that you wear sunscreen even indoors as well as outdoors. Just make it a part of your routine, like you brush your teeth daily, wear your sunscreen daily.
Okay, that was very informative. So even if the name suggests sunscreen, it's not only from the sun, from the rays of the sun, that we are getting protected from, but it's also from all the harmful rays that's going to damage our skin. So even if I'm inside the home or the studio working in front of a laptop or mobile, my skin is getting damaged from all the rays. So that was very informative. And whenever we go out to find a suitable sunscreen, there is a term called SPF, and we are always, confused now. What is SPF? What does SPF level mean? And why we should know about it while choosing sunscreen, doctor?
Yeah, so because there's so many sunscreens available in the market, there's so much of data now. With a click, you get your sunscreen delivered at your home, but you don't know what to choose from and how to choose from. It basically depends on your skin type, and it depends on what all things you should be looking for in a sunscreen. So the commonest word which everyone knows is SPF. But like I've told, sun rays contain UVA and UVB, both which reach the earth. So SPF is sun protection factor, which protects you from UVB. And there is something else called PA, which protects you from UVA. And UVA is the one which is more carcinogenic, it's more damaging, it causes delayed tanning, it causes phototoxicity. So you have to look for both SPF as well as PA factor. It's not only, there's a very common myth that the higher the SPF, the more protection you'll get. Okay. But it's not always like that. So the SPF you get in the market, it's SPF 30, SPF 50, SPF 70. It completely depends on how SPF 50 plus. So it depends on how much protection you're getting. Talking in terms of percentage, SPF 30, it is going to protect you around 94%, 95%. SPF 50 is going to protect you around protect your skin around 97%. Whereas SPF 50 plus is going to protect your skin for around 98%. So, just for that 1%, which is not really necessary for Indian skin, as long as you're not going on trekking in the Himalayas and not going for higher altitudes, I don't really think you need to have an SPF 50. Our Indian skin is blessed with melanin. We have a lot of melanin. It's going to protect our skin. So I feel, you have to see what skin type you are. If you're really fair, if you're skin type 1, 2. But Indians are almost like 3, 4, 5. Indians are 4 and 5. We don't need SPF 50 plus. That is first thing which you have to keep in your mind, that higher the SPF, higher the protection. Is not always true. It completely depends where are you going. If you're at home doing your regular work, I think SPF 30 or 50 should be more than enough. Another thing which we have to look for is what kind of occupation you are. If you are a swimmer, if you are doing a lot of workout every day, going for swim, going outdoors, if you're an athlete, then you have to look for something called sweat resistant or water resistant sunscreen. That is going to protect you, and that is going to be helpful for you. In other terms, for our daily day-to-day basis, applying sunscreen in sufficient quantity every 2 hours is more than sufficient. Like we don't always have to go for the fancy names and try and take off everything, because it's not really necessary. But yes, sunscreen is necessary, but choosing the right type of sunscreen, it's more important than than you having the knowledge that what type of sunscreen you're going to use. It's going to help you.
Right. So sunscreen is very important. We need to include it in our skincare routine, daily skincare routine, but it's equally important to choose the right kind of sunscreen with the right kind of SPF. And for that, you need to evaluate your skin type and your work culture, how much exposed you are to the UVA or UVB rays or other harmful rays. So that's also important. Now, you said, doctor, that it's important to see how much sunscreen you're applying and how often are you, reapplying that sunscreen. So you said twice in a day is okay, but still we would like to understand more on that, about the quantity, the way to apply it properly, and of course, how often we need to apply it.
Yeah. So there's this common saying which is called I'm at least like doing something. It's better to do something rather than not doing anything. So it's not true for sunscreen. If you feel that if you're applying sunscreen but not in the sufficient quantity, it's not going to help you. So you have to apply. There's something called as teaspoon rule. So talking in very technical terms, the amount of sunscreen you need is 2 mg per centimeter square, but it's very difficult to calculate like that.
Actually.
So there's something called teaspoon rule. So the 3 ml or just more than half a teaspoon, it's enough for your face, neck, and each arm. And 6 ml or more, just more than a full teaspoon. It's important for each leg, your chest, and your back. So this is something like you can, take an appropriate approximation. If you whatever area you're applying, you can apply in that area. Or there's something called as Stiffness Technique, in which there is something you have your palmar crease to your index finger. So this is considered as one fingertip unit. So these 2 fingertip unit, the whole line, this much amount of sunscreen is enough for your face and neck and arms, and all the 4 fingertip units from the palmar crease to the fingertip, this is enough for your legs, your chest, and your back, each area. So yeah, applying sunscreen and applying in sufficient quantity is very important, how much you're applying. And as long as you're staying indoors and going by your daily routine, applying it every 3 hours is sufficient. You don't have to apply more than that. The maximum amount of damaging sun rays is between 10 a.m. to 2 p.m. So early morning when you wash your face, just apply a sunscreen. If you're applying a chemical sunscreen, make sure you're applying at least 20 to 30 minutes before leaving outside. If you're applying a physical sunscreen, that's fine. And once you've applied, you have to reapply every 3 hourly. If you're sweating a lot, if you're going and working out, if you have skin pigmentation, if you have damaged skin, applying every 2 hourly is very important.
Okay, so applying sunscreen in the right quantity, in the right way, and reapplication is equally important. Now, we would also like to understand, doctor, that like we have various types of skin, right? I may have an oily skin, you may have a dry skin, somebody may have a normal or combination of sensitive skin. Now, how to choose sunscreen as per our skin type?
Correct. So the sunscreens which are available, you see a lot of spray formulations coming up. There's gel formulation, there's lotion, there's cream. So according to me, as long as you have a normal skin, you can go around with lotion based or cream based. That's fine. It can hydrate your skin. It can keep your skin barrier maintained. But if you have sensitive skin, if you have acne prone skin, it's better to go for gel-based formulation, because the oil-based or cream-based formulation, it's going to clog your pores. It contains ingredients which is going to lead to more acne breakouts. Then you'll get the notion that sunscreens are causing more acne. It's causing more acne breakout, but it's not true. You need gel-based sunscreen according to your skin type. Spray formulations, you can use it for the body. It's not as effective as gel-based or lotion-based. It's not as potent, but you can reapply it every 2 hours. You can reapply it more frequent, apply more quantity of spray. It's easier to apply on the back and on the body. So yeah, spray not for the face, for the body, and gel-based for your sensitive and acne-prone skin, lotion-based or cream-based or anything which is hydrating, which contains vitamin C, hyaluronic acid, or any hydration thing. You can use it for normal oily skin.
Fair enough. So now we know, for every skin type, there is a sunscreen or, formulation is available. We just need to pick the right kind of sunscreen as per our skin type, as per our work culture, etc. Now, the thing is, doctor, that despite knowing that, we need sunscreen is very essential. There are still 67% of people in our country who have not yet started using sunscreen as a daily skincare routine. What would you like to tell them?
Yeah, so like the times are changing. The most commonest thing which I tell my patients is times are changing. We had this notion which our grandmothers have passed it on to our mothers, and they're like, be natural and keep your skin natural. You don't need any ingredients. But no, times are changing. Our lifestyles is changing. The pollution rate has increased. The food we eat has changed. The amount of stress has changed. So we have to change our routine according to that. because we go out more and we are always working, and there's something, or if you're at home, you're on the mobile or you're on the computer screen or something, so it's going to damage your skin. Apart from pigmentation, there are a lot of like skin free radicals. It leads to early aging. One of the most commonest things sun rays does is early aging. So there's and then there are a lot higher chances of skin cancer. So to protect everything, and have to use sunscreen. And then there's this common myth that you need sun for vitamin D protection, and if you use a sunscreen, you're not going to get enough amount of vitamin D. But again, I would want to tell that whatever vitamin D you need, even if you're exposed for a very small amount of time, at least like twice a week in the sun, which happens eventually, unknowingly it happens, that's more than enough for your vitamin D protection. And what we're trying to protect the skin, apart from with UVB, which is going to protect your, make your vitamin D, the main concentration is UVA, which is going to damage more. So you need sunscreen to, protect your skin from a lot of things. So
definitely right, and definitely sunscreen is not acting as a hurdle in your absorption of vitamin D. So don't worry about that. Your body will anyways absorb vitamin D by whatever exposure you'll get under the sun. But you need to protect your skin from the harmful damages of the sun rays and other, rays that are emitted from the devices, etc. So you need to use sunscreen regularly, daily. Reapplication is equally important. Now, doctor, I think we have talked enough about sunscreen. We'll come back to that. But now we would like to talk a little about acne as well. Acne, again, a very common problem with people. Of course, teens are, the one who faces them the most, who are most stressed out with acne. But then even adults have the same issues with acne. What are the causes of acne? Why do we get acne?
Yeah, the most commonest thing every teen has wondered. As soon as you become a teen, you start getting those zits, you start getting those pimples on your face. And by the time you're in your mid-teen or you're in your 20s, everyone has accepted it as a part of their skin. And they're like, my skin is going to be the same.
We'll have to live with this.
Yeah, I have to live with this. But no, that's not true. This is mainly because of your hormonal changes. So causes of acne, it's mainly divided into two types. The first one is our patient related or the human related, and the second one is environment related. So environment related is when you go on high altitudes, when there's a lot of pollution, when there is a lot of skin damage, when there's sun exposure. So that is more of environment related, which you can't control. Human related, it might be because of your genetics, your hormonal imbalance, patients who have PCOS or any kind of hormonal changes, you're becoming a teenager. So that is another thing, is your lifestyle, the amount of stress you're taking, the amount of then other conditions you have, like if you have seborrhea if you're on your scalp, if you're applying too much oil, using the wrong products on your face, applying oily based products on your face, everything, basically it leads to clogging of your pores. So there's something called sebaceous glands in your skin which keep your skin hydrated, release sebum, and it's necessary for your skin, which is present around your hair follicles. So when something wrong goes in the sebaceous gland opening, it becomes clogged, and then there's dirt and bacteria and increased amount of sebum collection, which leads to inflammation, and that is visible as acne outside. So basically the whole thing, you can blame it on sebaceous gland and the sebaceous gland opening, but then the cause for that, it might be like a lot of causes. If you're taking if you're taking any medications or anything, smoking, alcohol, a lot of things. And when you pimples, you start getting stressed, and that stress is again going to increase your pimples. So it's like a vicious cycle.
Yeah, that times becomes a vicious cycle, your pimples leading to a lot of stress, your stress leading to more of pimples, and that again leading to a lot of stress. So today we are going to make out how we can actually reduce those acne and thus reduce the stress. Now, the thing is that, doctor, is there anything we can do to prevent acne breakouts?
Yes. So one thing is keep your skin hydrated, maintain a right routine for you, use right moisturizers, never let your skin become dry. Use the right amount of sunscreen and the right type of sunscreen. Don't let the sun damage, harm your skin, and then that can lead to acne breakouts. A lot of hydration, maintaining your skin, not taking too much stress.
Exactly. So maintaining a healthy lifestyle again will actually contribute in preventing acne breakouts. So it's really important to check what you are eating, how much stress-free you are, how much sleep you are taking. So all these small things do count. And Doctor, as you just mentioned, it's important to keep your skin hydrated, keep your skin, the moisture level should be there. Plus, you should always apply sunscreen, even if you have an acne-prone skin. Now, the problem is many a time people, especially those who are acne-prone or who have acne-prone skin, complain that whenever they apply sunscreen, their skin becomes very oily or sweaty, or there are more acne in formation. So what kind of sunscreen can a person with an acne prone skin apply?
Yeah, so the most commonest thing every teenager has is, I cannot apply sunscreen, my skin is already sensitive, I have so much of acne, I cannot apply sunscreen, my face is going to look so oily and
exactly
more prominent, doesn't look good in pictures. Yeah. So is sunscreen important for you? Definitely yes. Definitely yes for acne prone skin and sensitive skin. So if you're getting acne breakouts post applying sunscreen, it can be due to two reasons. One, it can be because if you're using sunscreen which contains oily products or oily ingredients, if your sunscreen contains beeswax, lanolin, or it contains any kind of oil, shea butter, or any moisturizing thing or oil, it's going to clog up your pores, it's going to lead to more acne breakouts. That is the most commonest reason. The second reason is if you're sensitive or if you're allergic to any component of the sunscreen, that's going to give you rashes, it's going to give you burning sensation, it's going to give you redness. So either you're allergic to it or you're using the wrong type of sunscreen. But sunscreen is very important for acne prone skin because when you're exposed to the sun, there's something called free radicals. So the sun produces UVA rays, basically. It produces free radicals. It damages your skin, leads to redness, inflammation, and it leads to early aging. So to prevent that, you have to use sunscreen. Apart from that, if you're being a good patient and taking proper treatment for your acne, if the doctor has prescribed any kind of retinoid, any kind of retinoid like tretinoid, adapalene, any kind of oral drugs, most commonly tetracycline. So all these are photosensitive agents, basically. So it's going to make your skin more sensitive when you step out in the sun than a normal person, because you're taking this treatment for your acne. So to protect your skin, maintain your skin barrier, you'll definitely have to add on a sunscreen with whatever treatment you're taking for your acne, especially the drugs which I've mentioned. If you're taking that, definitely yes to add on a sunscreen with that.
Right. So you need to apply sunscreen. No way out for a sunscreen, even if you have a acne prone skin. Another thing is that many times people who have acne prone skin will say that I don't need moisturizer, because already I'm secreting so much of oil. So do we really need moisturizer, especially those who have acne prone skin?
Yes, definitely yes. Again, for that, second common myth that acne prone skin doesn't need moisturizer, they don't need sunscreen, but it's completely wrong. They need moisturizers as well, because your skin barrier is damaged. There's something called retinoid dermatitis. You're applying something which is going to make your skin sensitive and dry. So to maintain the normal integrity of your skin, you'll definitely have to use a moisturizer. But the moisturizer which acne prone skin patients, which they have to use, you have to make sure that it's non-comedogenic, it's oil-free, and it's very light. You cannot use the same moisturizer as a normal other patient is using. The kind of moisturizer acne prone patients have to use, it's different, but they have to use a moisturizer.
Right. So it's better to go and consult the dermatologist before buying a moisturizer or investing in a sunscreen, because they'll be able to tell you what's the problem with your skin or what type of skin do you have, and according to your work culture, etc., they can actually advise you the right kind of moisturizer and sunscreen, and both of them are equally important. Now, doctor, what are the treatment options available for acne?
So treatment options, it completely changes on the type of acne. So acne, it can be either your teenage acne or it can be your post-adult acne, which is mostly hormonal. When you see adults of 30, 35-year-olds coming to you with acne, they're like, I'm not young anymore, but I'm getting acne. That is completely hormonal. And in teenage acne as well. So there are a lot of types of acne. So based on the type of acne, the treatment goes according to the type. If you're having hormonal acne, the first thing to do is try to maintain your hormonal balance, then treat your acne the way it is. If you're getting lots of comedones, or if you're getting lots of blackheads, whiteheads, which is going to eventually make your acne. So we give something called salicylic acid, or we give something called retinoids to dry up that thing. If you're getting a lot of pustules, if you're getting a lot of big zits on the face, on the back, then the treatment approach is going to be more towards the bacteria, which is actually going to cause it. And then we're going to maintain it with anti-inflammatory agents, something called benzoyl peroxide. You can use that. But yeah, it completely depends on the type of acne you have and the age at which you're having it and the cause of acne you're having it. If a patient is constantly picking on their acne, it's something called acne scoring. So they'll have more of black marks rather than acne. They'll have more of scarring. So the approach for that kind of acne will be completely different.
Exactly. So you need to go and consult the dermatologist and use less hands over your face when you have acne, etc. That's going to make it worse. Now, the thing is, doctor, that whenever we have acne, we'll go to the chemist first to find an over-the-counter cream or anything to, combat the problem. What's your take on that? How would you like to advise our viewers who are watching this session right now? And of course, how would you like to address the issue?
Yeah, so the first thing I would want to tell is you're doing nothing rather than, postponing your treatment. You're going to increase the time duration for when you should have started treatment. So whatever you go and apply, because acne is not something that you take one cream, apply it over the pimple, and then it's going to work like magic and it's going to disappear over a period of time. No, it needs a proper calculated treatment approach. You have to have proper approach of face wash. You need to include sunscreens, moisturizers. You need to include your creams, oral medications if necessary. So yeah, it's a complete approach, a management approach towards acne, which is important rather than just relying on a cream or a face wash, which you have seen, which you have seen a lot of reviews on YouTube or Googled it about, and just picked up some salicylic based face wash and waiting for your acne to go. No, it's not going to go. It's going to just elongate or prolong the time duration of your acne. And then eventually, if you land up in complications of scarring, then it's very difficult to treat with creams. So yeah, it's better that you get guided very early on, rather than trying to rely on one cream or one face wash for your acne to go, or drinking more water the whole day and waiting for it to go. No, it doesn't work.
Exactly. So see, if you have some problem, go and consult your dermatologist. It's very important, because otherwise, we eventually in doing home remedies or going to the chemist or asking a friend, we waste a lot of time. And by the time we end up to the dermatologist, our problem is so big that it becomes really difficult for even the doctor to, do something good to it. So your treatment, the length of it will get more and more lengthy. So to shorten it, to get a good healthy skin, please go and consult your dermatologist in case you see any problem over your skin. I will also take some of our viewers' questions, doctor. Vandana is here asking, I have a very acne prone skin. how should you treat my skin without completely drying out, especially in the summer?
Acne prone skin, she doesn't have acne, she just needs a maintenance kind of treatment, right? That is what I get from the question.
Okay.
How do you treat it in the summers? Acne prone
Yes.
summers. So yeah, definitely, like we've been talking about, you don't have to dry your skin out to treat the acne. That is the first and foremost thing I want to tell. If you're going and sitting on the beach, your acne has reduced, but the next day you see there's a lot of marks remaining behind. So drying doesn't mean treating acne, is first and foremost. Second, for the summers, you have to use face wash, which is like I told, salicylic, benzoyl peroxide. Both these face washes are available in the market. You can use them. You can use a sunscreen, which is specially for acne prone skin. If you feel your skin is drying out, use an acne prone moisturizer for acne patients, acne prone skin patients. Yeah. Maintaining your skin is easy as long as you do it with a lot of dedication. That should be fine.
Okay. We have Rajat Saxena asking, how do I avoid a white cast with sunscreen?
Yeah, so it depends on what type of sunscreen you're using. White cast, by white cast, it usually is because of physical sunscreen or mineral sunscreen, which contains zinc oxide or iron oxide. So this is what leaves white cast on your skin. First and foremost, you have to make sure you're applying the right amount of sunscreen. Just make sure you're not applying too much, like we've explained before. Second thing, if you're using the right type of sunscreen for your skin, if you actually need a completely physical sunscreen, or what I would recommend is something like a broad spectrum sunscreen or something which is incorporation of both physical and chemical, it works better. So yeah, choose the right type of sunscreen. I think they're using only the physical ones. It is the ones you like you see in cricketers and all, they have always this white thing on their face. So yeah, that is a physical sunscreen. So yeah. Just change the amount and use the right amount. Just change the sunscreen.
All right. Palak Dubey is asking, is a new skincare routine necessary when working from home?
Yes. Yes. Yes, definitely. Because working from home has become our new normal, and there's the 9 to 5 thing has now changed into hybrid thing. You just go twice a night. Yeah, with your skin, you have to maintain the type of maintenance or the type of routine has changed definitely at home and at work. So add a sunscreen, Palak, to your skincare routine. Definitely add a face wash at home. Reapply sunscreen even if you're at home, not going outside. Reapply every 2 to 3 hours. Wash your face at least 2 to 3 times a day if it's not very sensitive or acne prone. And I would say not just keep it hydrated, like not maintain, not use too many products and damage your skin. You don't need that much. As long as you're having a normal skin, that should be fine. Just a proper moisturizer, sunscreen, and a face wash should be fine.
Keep it simple, Palak. You need to wash your face, you need to apply a moisturizer and a sunscreen without fail. That's it. Shruti Nigam is asking, what is the difference between regular and sport sunscreen?
Sports sunscreen.
Yes.
Yeah. So this is what I was mentioning before. So sports, the person, patient, like people who are usually into athletes and they're who are usually into sports, they should go for long-lasting sunscreen. They should go for water-resistant, sweat-resistant sunscreen, and more of physical sunscreen rather than chemical, because that is going to so physical or chemical. The things which I'm mentioning, it basically depends on the way they are acting. So your physical sunscreen, it's going to reflect the sunlight completely and it's going to protect your skin, whereas a chemical sunscreen is going to absorb it and then scatter the sunlight. So that is the reason we tell you have to use this chemical sunscreen 20 to 30 minutes before going out, whereas for physical, it's not necessary. So yeah, for sports, it should be of higher SPF. Look for a water resistant, sweat resistant one, and look for something which contains zinc oxide or iron oxide in it.
All right. And we have Priyanshi Sharma. What type of sunscreen should I put on my kids?
On your kids, yes, definitely. I feel till 6 months, kids don't need sunscreen. But if your kid is about 6 months, look for something which is hypoallergenic. Hypoallergenic. Look for physical sunscreens. I would not recommend chemical sunscreens in kids. Physical sunscreens are completely safe. Look for something which contains titanium dioxide, zinc oxide. Look for something which contains iron oxide. Yeah, that should be fine. Look for a completely safe kid sunscreen. Yeah, so it should be for sensitive skin, like I told, hypoallergenic, and it should be a physical one, about 6 months of age.
All right. And Dr. Priyanka, before we sum up the session, any takeaway message for our viewers?
Takeaway message, like I told, like you brush your teeth, just incorporate sunscreen into your daily routine. If you're, we were especially going to talk about acne, like we've spoken. I wanted to add, if you're having acne prone skin, you can look for something which contains niacinamide, which contains zinc oxide. So these are something which are zinc oxide. It's both acts as a sunscreen, it acts as an anti-inflammatory agent. It's going to help reduce your acne as well as protect your skin. So look for something which is gel based for acne prone skin specific. Consult your dermat rather than getting confused and relying on too many sources. They'll guide you better. Definitely use a good sunscreen for your skin and it will help you.
Thank you so very much, Dr. Priyanka Jaju. It was a very informative session, and thank you so very much again for your valuable time.
Thank you.
And we really look forward for many more such sessions for our viewers in the coming times with you.
Thank you.
Thank you. And thank you, viewers, for your active participation, and stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.
Bye.